Episode 34, Cutoffs and Coffee. Welcome back, everybody. These are your hosts, James and CT from T3 Performance. Today, we've got an awesome conversation with Dr. Jack Lemmon. Dr. Jack, PT, DPT, CPT, got a lot of initials after his name, and you will hear the whole story about how he got all of these as we dive into this podcast. Dr. Jack is training out of Upgraded Industries in Mentor, Ohio. Again, he'll talk about that a little bit in his story. And he's also the head of sports performance at ISA in that same area. That is the International Sports Academy. Today, we take a deep dive into basketball, the sport of basketball, the injuries that come from playing basketball. A lot of talk about the ACL, what we can do, prehab, rehab, return to play for the ACL. And then we also finish up the conversation talking a lot about the greatest NBA basketball player of all time, Allen Iverson.
And it's safe to say Allen Iverson was an underdog when he was coming up through the ranks in the NBA. And today's podcast is brought to you by the Underdogg Spiky Trigger Point Therapy Lacrosse Ball 2.0. So now this ball itself has a bunch of spikes. You can see how aggressive it is, but it is the best thing that I've used on my hips, on my feet, on my calves. It really gets into a spot, and what you want to do with it is just roll on it until you find something that hurts good, right? And then just breathe through that. Definitely a good thing to do after you played some pickup hoops with the boys, right? Make a couple runs, get a couple wins, all right? Then when you're done, calm down the body with a little rolling on your trigger point ball.
Hey, and if you don't like what we're doing on the podcast, I am sorry. We'll try to be better. If you do like what we're doing, follow us on YouTube, follow us on Apple or on Spotify, listen, rate, comment, share the podcast, reach out to us, tell us who you want to have on the podcast, and we'll try to get them on and talk to them. Follow our individual social medias where we tease out who we're going to have on the podcast the next day or the next week, give you, the listener, an opportunity to ask that guest questions. So here we go, without talking about it anymore, episode 34 with Dr. Jack Lemmon. Enjoy. Dr. Jack, welcome to the show, man. Long time coming. We appreciate you joining us for episode 34 of Cutoffs and Coffee. How are you today?
Hey, I'm good. Thanks for having me, guys. Appreciate it.
Yeah, absolutely. I'm excited to get in this conversation. Wanted to tell a quick story. We have an awesome opportunity. James and I working in different places between T3 and some offsite accounts. And we meet a lot of great people. And one of my favorite things to do is match up great people with great people. And so this connection with Dr. Jack came from one of the athletes who I work with at NDC and who Dr. Jack works with in his off seasons. And his name's GB, great guy at Notre Dame College. And he actually came up to me yesterday in the weight room. And this was funny with the timing. He said, CT, I did something to my ankle. I landed on somebody wrong. What do you suggest I do? And I said, well, here's the first thing you're going to want to do. And before I even finished saying what I was going to say, he said exactly my words, but he said, this is what Dr. Jack told me to do. And it was one of those things that I said, oh, okay, this is perfect. Like, we're literally saying the same thing. We're talking about like rehabbing his ankle the same way. And I told him, I said, hey man, he's going to be on the podcast tomorrow. And he said, oh, I got to check that out. But again, shout out to him, because he's the one who connected us. So, I appreciate all the good work you're doing. And thank you for following up with this and finally being able to get on the podcast.
Yeah, no problem. GB, great kid, awesome athlete.
Yeah, Coach, but before we get into kind of the bones of the podcast and hearing about, everything you do and start asking you, our questions. We want to know a couple things about you. So number one, what's something that we need to know about you, James and I as hosts, and also the listeners, that we can't find from a quick Google search?
Okay, so this is one I was thinking about. So, like everybody, obviously, when you do a Google search, you're going to see the Instagram, like the sports stuff and all that. I actually didn't go to school, like for what I'm doing now, for like rehab or like sports medicine, until I was 27. So I kind of, I was an athlete all through high school. I, played baseball, soccer, basketball. My dream was to go play basketball, and that didn't really happen. I wasn't that good. Or I should say good enough to like get a scholarship. My parents didn't have like a lot of money to send me to school. So I went the soccer route. I got hurt my first year. And then after that, I wanted to be a lawyer. That's how it kind of like all started out. But I think that was just from me trying to like get out of trouble all the time. So I was good at talking my way out of things. So everybody's like, you should be a lawyer. I was like, yeah, that sounds good. And I saw how much reading and like work they had to do. And I was like, because my grandpa was a defense attorney. So I was like, you watch the shows on TV, it looks cool. And then you actually start like doing the work and you're like, yeah, no, that's a little too much for me right now. So I ended up just completely skipping school and I just packed my stuff one day and just moved to Charleston, South Carolina. I lived down there for like 6 years, bartended in the restaurant business. And I got hurt down there. My buddy was a physical therapist and I went and saw him and it kind of just all like started from there. Like down there after I got hurt again, and I kind of saw the different world and lived life a little bit because my first freshman year in college I didn't really know what I wanted to do. I just knew I wanted to play sports. Not that was gonna be my way, like out of like going to school. And then you get hurt, and you're like, oh well, I actually have to do schoolwork now. Like there's actually stuff outside of sports, and I just don't think I was ready for that. So that's what I always tell my players too. It's like you might not know what you want to do now, but if you just stick with your love and like who you are, and then it'll eventually like figure itself out and you'll find your path and what you want to do. No, I mean a couple of times probably, but
yeah, I did that. I did that for a while.
We were playing beach soccer, and I liked it because when I was in college, I partially tore my ACL and my meniscus in college. My foot got stuck in the turf and like twisted. The normal ACL type of thing on turf. And, I did rehab and all that good stuff, but I just wasn't at the top level that I was able to play at college anymore. So I just I was like, all right, well, this is it. I need to figure out something I want to do and get out of Ohio for a little bit. So one day I just told my mom, I said, I'm going down for the summer. I got a job. And then I stayed for 5 years.
Not a bad place to stay.
So
I'd imagine.
Took the long route.
James, were you going to say something?
Yeah, no, Charlotte's a great place to be. I'm surprised that you came back to Ohio. But
I tried to go to school down there, but the whole I was like, I'll take 8 o'clock classes. That way I'll get up and I'll go. Well, it's still bartending. So it's kind of like one of those things, I was kind of in that life that, you get out of work at 2:30 in the morning, 3 o'clock, and then trying to do that. I was like, I need to go somewhere where there's like nothing to do, where I'll actually focus and like finish school. And my mom at the time was living in Ashtabula, Ohio. So there's like literally nothing to do around there. So I went there, got a job at a hospital there as an aide, and then just worked my way through school.
Like you said, the long route. How about question number 2? The last skill that you taught yourself, being a busy guy, and it's hard for you, I'd imagine, to find times to work on yourself. But can you remember the last skill that you taught yourself or something that you're currently working on?
Something I'm currently trying to teach myself is just relaxation methods and like meditation. That's like the biggest thing is like, just being in like the sports performance training world and being around athletes and being like an athlete yourself and working out. It's hard to just, cut the switch off when you get home, to just like relax and like be in tune with just being off of work and not doing the runaround all day. So that's something I've been looking into, just, looking at a couple books, trying to do some YouTube videos, start off slow and like try to at least give myself like 30 minutes a day where I'm just not doing anything or not thinking about work or, put my phone away and just kind of focus on myself and try to get myself relaxed and ready just so my own body can recover. It's a lot. I mean, there's days that like, you go to bed, I go to bed tired, like I'm going to fall asleep in 2 seconds. I get to bed and I'm wide awake. It's like just trying to get myself on that able to like meditate and just relax, shut the system down for a little bit.
Just, get away from my phone and close my eyes and focus on my breath.
Yeah.
And you try to do that intentionally for, 30 seconds even, and it feels like forever. It's such an interesting process. But then there are also a lot of, we had a mental performance coach on the last episode, and there's a lot of carryover between what you do there, meditation when you work by yourself, and then when you get out there on the playing field and things are crazy and wild and you don't know what's going to happen. If you can kind of center yourself again and focus on your breath, that's so important and super helpful. let's go. You told us a little bit in the beginning, but kind of catch us up to where you are now. Tell us your story. Growing up, what that looked like. You said you said you were always an athlete, wanted to play sports, and wanted to play basketball, and then kind of made your way out east, and then came back. And then, tell us about exactly, if I know it's hard for you to do, and we've talked about this to that extent a little bit, like what exactly do I do? What's my job title? And then kind of fill us in on what you're doing now and where you're at.
Yeah. So like I said, I was in Charleston. I came back and went to school. So I started off in physical therapy assistant school. I kind of wanted to do the physical therapy route, but it's 7 years, and I was just thinking, like, let me just work into this and make sure it's something that I really want to do before I just jump all in and like just say I'm going to go bachelor's and go to grad school. So I went to PTA school at Kent State, and so I graduated with that. I started working with Cleveland Clinic affiliate ACMC, which is an Ashtabula around by Geneva, Spire area. And so I worked in outpatient, like sports medicine, worked with, a variety of patients, anything from like neurostroke to like orthopedic post-op patients, and then just the normal like overuse stuff. So I did that for patient care and treatment for six and a half years before I decided I wanted to go back and get my bachelor's and kind of start my own thing. And that kind of came about just, seeing the athletes come in the clinic and they're hurt and same injuries over and over and over. And like when you're seeing 8 to 10 patients a day, I was there 6 years, you kind of start seeing the same thing and the same trends. And that kind of got me interested in more of the training aspect of it, because, I was doing all these treatments on kids that were injured to get them back to playing. I just kind of linked it up one day, and I was like, what if I just added this into like actual training, and then just kind of branched off of this as like a protocol to build up a training program. So I started doing that. I went and got my bachelor's at Kent, and then I went to University of Findlay. It was like a weekend transition program. So it was like an accelerated doctorate program at Findlay. So I did that for 2.5 years. And once I graduated with that, I was at maybe 4 weeks. And then I put my 2 weeks notice in. I left. Well, I was actually training, working with a couple kids there in the gym that was affiliated with the hospital. Funny story. So I'm in there working out, and I had a couple guys, their parents worked at the hospital. One kid went to Mount Union, played football, he played tackle there. And so his dad was like, can you work out with my kid? And I was like, yeah, I'll work out with him. So I started doing stuff just with him, like me and him would work out together. And I ended up having a meeting with the lady. They emailed me, and she's like, yeah, well, you can't work out here no more. And I was like, what do you mean I can't work out? She's like, you're training people for money and building the business off of us. And I was like, this is affiliated with the hospital, and this kid's dad like wanted me he's working out with me. I wasn't making any money. I was just training. He was just working out with me. So once that happened, I was like, all right, I need to get out. I need to start doing my own thing. Like I need to branch out. So that's when I ended up leaving there. I came out to Mentor, met DJ, who's the guy that owns the gym and Mentor Upgraded Industries. He's an MMA fighter. So I went there, just to get a new look at a new gym, and started doing a little bit of like my own workouts there. He ended up having a title fight come up, and he just came up to me. We became friends at that time. He saw me working with a couple of guys, and he basically just said, you know anybody that trains MMA fighters? And I was like, no. I was like, I've worked with football and basketball. He's like, well, you're training me. And he went outside, fired his coach, came back, and he's like, we start next week. And I was like, oh shit. I was like, what did I get myself into? I'm going to be training MMA fighters now. Oh, here we go. So that's kind of how it all started, like the training aspect of it, of what I do. I still do work in the clinic, PRN. So I'm in there like maybe twice, 2-3 times a month, and during the week or on weekends. And then I do my private stuff at the gym. So I'll do everything from sports performance training. I do rehab there. I do recovery. Like my athletes that come in private, they usually will do 3-4 days a week of sports performance training, and then recovery stuff with them, whatever they need to like get back for their off season. Then now I'm with ISA, which is International Sports Academy. It's a national prep basketball team. So I'm the head of sports performance there. I handle all their strength and conditioning, recovery, and then I do also like private rehab with them if they get injured. So there's 2 post-grad teams, and then there's 2 high school teams. One's a varsity and then one's a national prep team. So the national prep team I actually travel with when we go to away games and like during the season. So that's basically, I mean, right now we're in season. We get done March 15th. I do a little bit of the hospital, a little bit of private stuff during the season, just because I'm gone so long and I can't like be there consistently. And that's, as you guys know, that's like the most important part when you're doing a program, is like being consistent with it. So once off season, March 15th, that's when I'll start going into more like some hospital stuff and then my private business stuff at the gym.
So, Jack, that's a non-traditional way to get to strength and conditioning, to say the least, with a lot of different experiences along the way. As you start getting into the strength and sports performance world, you said that there were some injuries that you were seeing that were repetitive, pretty predictable, I guess, from the population that you were seeing. Did you have any paradigm shifting moments in terms of like what you thought of strength and conditioning when you were an athlete, and then kind of shifting into your career path as a strength and conditioning coach, plus a physical therapist, that kind of changed the way you thought about either performance training or that injury cycle?
Yeah, I'd say there's probably 2 things, but one thing was like I wasn't big on like taking time in the beginning, like when I was first starting out, even in the therapy role, even with me playing sports. I wasn't big into like mobility stuff, and like not just saying stretching, but like putting a focus on like actually like getting your body able to move better, just even without lifting. I was more just, I'm going to go in the weight room, I'm going to lift weights, and if I need to jump higher, all I'm going to do is jump and squats. And like I kind of just was set on like what I knew, because I played sports. I graduated high school in 1998. So I didn't have, like, when I got hurt my knee, I basically got on a table, they put ice on it, had me do some quad sets and like straight leg raises. And I was like doing the same exercises the 60-year-old guy next to me that had the same thing was doing. But I needed to get back to a sport. So I was kind of set in that way that, you have an injury, this is what you're going to do for the injury. You're going to do A, B, and C. I didn't really look at the whole aspect of it when I first started out of like, all right, this guy plays a different sport. He needs to do these movements, do this. Like, this is a mobility issue he needs to get better at. And just the overall, programming of it, like doing the splitting up programming and like building strength, speed, agility, quickness, like putting all that together into a program to where it all actually just builds off each other and makes sense for getting the best amount of work out of the time you have with somebody. Because you get in the gym, you got 45 minutes to an hour of like actually getting after it if you're doing the right stuff, and you can get a great workout out of that. But I would say, yeah, that was my biggest thing, was leaving when I left. I wouldn't say when I left the clinic, but after being an assistant, because assistants, all we do is like the treatments. So I didn't do any of the evaluation process. We weren't allowed, because I wasn't a doctor at that time or a physical therapist. So basically just getting into like the assessment of the whole body as an athlete, like watching how they move, watching how they run, watching their ankle mechanics, landing, jumping stuff. And you just actually honing in a little bit more on that, because I was kind of just brought up like, they have an ACL injury, here's the protocol, and you're going to do it with everybody. Like, I don't care if they're 12th grade, 11th grade, or 60 years old, they're not retired, not even get back to doing anything. So it's just kind of putting my focus on like actually looking at the whole athlete as a whole, and even like their past history and past injuries and things that they went into.
Yeah, I just wanted to follow up there, Dr. Jack, because you had mentioned 60-year-old, 16-year-old, didn't matter. Same knee injury, same return to life protocol, I guess we'll call it. I just had a conversation with a Division II football player yesterday about his return to play stuff. And it was very low level stimulus. It was very, long-term. Hey, we're going to need you on this, one set of 30 reps 3 times a week for 15 weeks and then we'll see you again. I mean, what's it going to take for us to bridge that gap a little bit between sports performance coaches, and James does it all the time, works with return to play guys all the time. We feel like there are things we do that are beneficial. And then on the PT side, obviously there are things they do that are beneficial, but what's it going to take for us to eventually bridge that gap?
Yeah, I think it's like, not only just like community, and it's hard to depend on where you work at. Like for the clinic, we had like athletic trainers that were with us. So they were able to, like, when I started getting into like actually the strength and conditioning part of it, they were actually there with me. So I was able to like show them and then pass them off on there. But the big thing, like I found, was just the communication, and then acting like, you're not separate. You're actually trying to get the athlete better. And I think there's like this separation between everything. Like physical therapists will have their, like, you can see it on Twitter, like physical therapists Twitter, like they'll have their like, oh, we're doctors and we do this. And then I'm like, no, you're physical, like you're basically, I'm a physical therapist and I don't even look at it like that way. Everybody called me Dr. Jack because they called me that before I even graduated. Just like stuck with me. So I used it. But that, and then like strength and conditioning stuff, like return to play, sports performance, there just needs to be like a continuance of care through everything. And the hardest thing you see in the clinic is insurance. Like they'll have different insurances for everything. And I've had an ACL post-op athlete, high level high school athlete going to college, like wanted to play Division I basketball, and they gave him 12 visits for physical therapy post-op. So it was like, so I'm going to see him once a week for 12 weeks. And that's like, what do you want me to do with that? And then they're gone. And, some of these people, they don't have $100 or whatever, $120, whatever the hospital's like cash pays are, to come 2-3 times a week. And so then they just get like lost in the shuffle, or they go to somebody that's a trainer that doesn't know what they're doing. Like, obviously you guys do a great job. Like if I could send my guys to you guys, I would do it. It's like, but then some people are going to work out with their uncle who's, he played basketball 20 years ago. He knows what he's doing. And then you're like, oh shit, I just did all that work. And now they're going to this. So it's hard to like people. They just need to like check their ego at the door and just understand it's all about the athlete. It's not about what degree you got, what certification you got, who does this and that. It's just, you need to just focus and like be educated on like what clients are walking in your door and what type of athletes you have coming in your door. Like, care about, if you're a sports performance guy, care about that they had this surgery and like what you have to take care of. If you're a therapist, like educate them as much as you can and talk to the people they're going to train them afterwards. Like, just communicate.
So we're kind of starting to talk about, the athlete that you're in front of. Let's say you do have a return to play case where you are getting an athlete in the sports performance setting, and he's already been cleared through, PT if he did it somewhere else, and now you're working as a performance coach. What are some of those first, couple of sessions look like for you to get to know that athlete and kind of, dive into that holistic approach that you were talking about earlier in your paradigm shift? Like, what are some components of that holistic approach that you like to look at that athlete in?
Okay. Usually, like, I kind of treat it just like I would like almost like a physical therapy evaluation the first time I meet them. So usually by the first time I meet them, I've had like talks with them on like social media or text, or they've reached out, or I know their surgeons sending them to me. So I'll basically just review all their records, like what surgery they had. I'll get their last physical therapy notes from the therapist. So I'll review all that stuff to kind of see where they ended at, like what they're still lacking, if there's any questions for that before I meet them. I'll just call the therapist. But when they come in to me, I'll basically just do like a fast, like, thorough orthopedic exam, basically, depending on what it is. So if it was like an ACL tear, I'll like get in there, I'll measure their extension, make sure they got full extension. That's something we need to work on. See their knee mobility, work on their ankles, just kind of see how their hips are moving. Because a lot of times, like we were saying, like physical therapy, they kind of just treat the issue that's going on. So you have a knee injury, more times out of none, their hips are going to be tight. They haven't been doing any upper body type of stuff. So it's kind of like just doing a body assessment, orthopedic assessment. I'll go out and do, if they're not too far, if they're able to still jump and like do all that stuff, I'll do jump testing with them, test their vertical, do some lateral testing. It's like just basically a lot of, depending on the sport, I'll just do the test based on their sport and what they're doing. It's like basketball, I'll do their vert test. I'll do a 5-10-5 test, do a T test, and then like just the overall conditioning test on the treadmill just to see how they are conditioning wise. Just kind of formulate the plan around there. I like to do like almost like a phase training type program. So I'll make sure that like all their mobility is there with their squats, their single leg stuff, RDLs, and just make sure they kind of got that form down, the basic form. And then I just start like stacking stuff on top of that based on like what sport they're going to be returning to.
Have you just always been drawn to basketball, and that's how you ended up kind of in this situation you're in now?
First, I was working with, like I was saying, the kid from Mount Union. So he was an offensive tackle. He was there 4 years. That and like baseball and basketball. Like football and baseball was like the first stuff because that was like the main athletes in the town I was at. Like there's a lot of baseball and football guys. So I started off there and then went into the basketball realm. Once my buddy was at Cleveland State. He was actually a grad assistant there. And he had one of his players get hurt. And Kenny Carpenter, he actually plays overseas now. And that was actually my first basketball, like kind of like call it like big time like basketball guy I started working with. And he came in for 4 weeks. I worked with him and he was like, I'm coming back next summer to work with you. And I was like, shit. And me, I'm always like, whatever I like everything I do, it's simple. Like everybody probably knows this. And then once you start working with people, you start realizing, shit, maybe I do have like some knowledge that other people don't have that are training people that's working. So I never really put 2 and 2 together until I started working with a lot of basketball guys. And just started seeing their progress over like 8 weeks, 12 weeks that they're home during the off season. And then, like I said, doing their tests and then retesting them and just having that verification that, they're getting better. They like to see results. So that's the biggest thing, is being able to test and retest them so they see that things are getting better. Not just saying, oh, good work, you're grinding, you're doing better, you're good.
Well, I think a common thing that we say too is like, it's not what you do, it's how you do it. So even if you take like a simple exercise, like a single leg RDL, right? We could have 2 different coaches with the same athlete talking them through a single leg RDL and having them perform that exercise. And depending on how one coach communicates that versus another coach, we might get completely different outputs from the same exercise. Do you feel like that's something that you've been able to hone in on with your coaching, is like how you're communicating, because you have this physical therapy background, a deeper dive into what mechanically should be happening, and you're able to relay that to your athletes in a different way than maybe strength coaches they've worked with in the past?
Yeah. And I think it's just, the thing I see, the biggest thing is just being like that detail oriented with stuff. So, you're just talking them through like what they're doing, their mechanics, the hip hinge and all that stuff, and like making them understand, like some of these athletes are 6'9", 6'10" that I'm working with, and they're in here and they're like, their mobility is not that great just because they haven't focused on it. And they're like, yeah, I was getting yelled at because I wasn't going ass to grass when I was squatting. And they're like, then it kind of like frustrated them because they just don't have the mobility to do it. So then they get in their head that they're doing it wrong or it's not helping. And so just being able to like be detail oriented, but enough to where they're going to understand it. I don't get too like medically termed with it, so that they're just not like, just kind of cut me out and not listen to me. So like, yeah, it's huge building a rapport. And what I always tell people is like, it's easy to build a good program for an athlete, but if they don't buy into it and don't want to do it or don't like you, then it's not going to matter because they're not going to do it anyways. So it's just being able to build that rapport with the athlete and then kind of educate them as you're going through stuff, show them how to do things. Like I use a lot of mirror stuff so they can see, like in the mirror, I record them and then show them like, here, this is what you need to work on. And then just kind of test and retest even with the movement stuff, just until they get it down, or just use a different variation to where they have to, bring it down a level to where they can use a device or use something assistant so they can get that technique down.
We really only use mirror stuff when we're pumping these arms up.
Yeah, I know.
We got to start. Yeah. We got to start using it for some other things. There's a lot of benefit to recording an athlete and showing them how they move. But I think there's also a, kind of a mental, emotional, psychological benefit about them training in front of the mirror sometimes when we're, working on aesthetics. You kind of brought up a point that I wanted to talk about earlier. a second ago, when you said it's making this connection and communicating with the athlete, you told us your story earlier. Your buddy who you ended up training, the MMA fighter, he fired his coach to train you. And I'm thinking, well, it wasn't because you were giving him the perfect program and it was the sets and reps and it was the exercise selection. I'm thinking it's because of just the conversations that you were able to have with him to get, a certain level of buy-in. That was different than his other coach was doing. And I think in this space, being sports performance coaches, it's so easy to roll out programs and to look at numbers and sets and reps and say, this is where the progress is made. But it sounds like you keep coming back to stories where it really doesn't have to do with that. Yes, it's important here and there, but you have guys, coming from Croatia and overseas to work with you. And you have guys who go play a season and come back to Mentor, Ohio and work with you. Do you think that's, a big part of one of your strengths is just communicating and being able to talk with these athletes?
Oh yeah, I think that's the most important. Like, obviously you want to have the base of the knowledge and know how to train and do all that stuff so they don't get injured and you don't like do something crazy with them. But yeah, I think that's a huge part of like what I do and just how I even get players is a lot through word of mouth. Like my social media, I didn't really focus on that too much until probably last year when I first signed, or a year and a half ago when I signed with ISA. And then more athletes I started working with, I was like, I need to start like putting this out there and start talking to people. And they're like, this is the first podcast I've ever done. So I like, me and my buddies were talking about doing one. I was like, yeah, it sounds cool. Like, I don't know, we'll see. And then when you messaged me, I was like, oh yeah, I'm going to go test that out, test the waters. And so if I'm rambling, I'm sorry, but I talk a lot.
No, you're allowed to ramble. We're not. So keep going.
Yeah, that's fine. Yeah, that was the biggest thing with DJ. Like, he saw me working with a couple like athletes. Like, I'd have like 6'7", 6'8" guys like doing stuff that he couldn't do, and he's probably like 5'7" on a good day. Pretty athletic, like he can do backflips and stuff. But like the guy that was training him, he had zero. If he's a boxer, fighter, MMA, he had no like rotation ability. His hips were off. He was basically just right here the whole time. And then he's watching these athletes do stuff that are like, they're skinny. He's got the DJ has a bunch of muscle, and he's like, how the hell are these kids doing it? I can't even do that. Like, how are they doing that? So he always ask me. Then we just get into conversations about like mobility, recovery. He's like, yeah, I don't do any of that. I just go in there and fight people. I was like, yeah, well, if you want to look at a different approach of fighting, I was like, your punches are going to be harder. Your kicks are going to be harder. You got to train the ranges that you want. Like, that's going to build up your muscle. Like, so we started working on a lot of that stuff, just having them before I even started training them. I just started doing like mobility and recovery stuff with them, just adjustments and like trying to stretch his hips out, doing some exercises for boxing and MMA type guys. And then, after that, a couple of weeks, he just went out and he's like, you're training me now.
It is very interesting that we still see that today in sports performance. And we'll get into different schools, offsite contracts through T3, and we'll work with athletes who have had strength coaches before, who have our same job title, but communicate things and do things completely differently. And it's mind blowing sometimes, some of the poor training protocols that we see out there. And like you mentioned earlier, you said, well, everybody knows this stuff. Maybe I'm not doing anything special. And I think it does come down to just being able to communicate all that stuff to athletes, because a lot of athletes have had coaches, but not every athlete has had a good coach. And I think when you actually find a good coach, that's how you get all that buy-in. That's how you get guys coming back. That's how James gets athletes to come back 8, 9, 10 years in a row, from high school to college to post-college, when they're playing professionally, all come back to work with him just because of that. Yes, we're doing the same thing. We're not doing anything crazy, but we're just doing it at a different level and have a different level of communication with the athletes.
Yeah. But I think you see too is like, I see a lot of strength coaches, and even therapists, how I said they just treat one thing and this is what they're going to do. Like, you see a lot of strength coaches, or even on strength and conditioning Twitter stuff. It's like they're basically training athletes like bodybuilders. It's like, you know, you're gonna do chest and shoulders a day. We're gonna do back and buys tomorrow. We're gonna do legs, and then it's like, I've had a basketball player come in. This was right after COVID, and he ended up coming to our school too last year. But 17,000 points, great kid. Went to Warrensville High School. His dad messaged me. He's like, "Yeah, I gotta get my kid with you." He's like, he's been training with this guy, and he's just getting fat. He's like, and this kid is a guard. And he comes in. You could see him he's on my Instagram. I got a before and after picture of him. But he came in, and I was like, and this kid was super quick, like ridiculously quick. And I saw him, and I was like, "Is this the same kid that's like that I was watching all these videos on?" So I asked him what he was doing in his workouts. And he's like, "Yeah, he's like, we'd have chest and tris one day, we do shoulders, and he's doing all machine work. Like, and this guy's just loading them up, like trying to beef them up." And I'm like, "Dude, this is not good. Like, you gotta play basketball. You're a point guard. Like, you need to start doing some like single leg rotation stuff, like multi-plane, like stuff that you're gonna be doing in the game. That's what you need to do." And so it's just crazy. Like, they just think, a lot of people just think like you just build muscle, like that's what you got to do, and they just forget about all the other stuff. Like, "Oh, he's getting big." I'm like, "But can he move?" Like, it's because I went that route. I mean, when I was 31, I went to try to do the body. I was 168 pounds, and I was like, "I'm gonna do bodybuilding. Why not?" I got up to 238 like in 2 years just bodybuilding, and I started training athletes that next year, and I was like, "Dude, I couldn't even do an agility ladder." And I used to be able to dunk when I was like in high school and college. So I'm like, I can't even go up steps now. I'm tired. I was like, so I couldn't imagine like what these kids are going through that have these bad trainers, and then to go to somebody else and have them that know what they're doing, and they're putting through all this stuff, and they're probably like, "Oh shit, what is all this stuff? Like, I don't want to do this. I want to go back to the easy stuff, but just throw weight around."
Yeah, just because you follow men's fitness or muscle and fitness on Instagram does not make you a strength coach. Last question, Dr. Jack, about kind of the ACL stuff, and then I want to move on to some of the other notes we have. But we understand that now we can't prevent injuries in sports. That's just something that's impossible to do. But are there things that you've been able to see maybe after you've rehabbed some athletes and gotten them back onto the court, gotten them back into the gym, that you've now started adding in the beginning of training programs to hopefully help kind of reduce the chance of injury for some of these athletes? And if there are things like that you've been able to see carry over and help keep athletes healthy, what are some of those things that you've been able to do?
Yeah, I mean, let's see. So ACL wise, probably the biggest thing is like taking them to do like getting them out of the clinic and just getting them on the court, even if it's just little things like, sidestepping through a hurdle, or like getting something that's like more basketball, I would say, or sport focused, even if they're not doing like the whole full like contact thing, just to get their mental game right. Because when you're in the clinic working with a lot of these kids and you're doing the same thing for 2 to 3 months, it just gets taxing on them. And it's even got to the point where I'll bring in athletes that have had ACL surgery, and they're, say, at week 6 or 7 or month 6 or 7, and they're jumping and doing all this stuff just to get the kid that's not doing anything like mentally prepared, like, "Oh shit, like I'm actually going to get to that point." When you get hurt, you think that's it, I'm done. Like, I'm doing quad sets for 20 minutes on a table, and like I'm never going to get back to the sport. Like, my leg, I can't even, like, you can't walk, you can't jump, you can't do anything. And then you see all your friends, you're used to being competitive, and you see all of them still playing. So it's one of them things, right? I try to bring in another athlete so they can see like the progress that they went through and kind of where they're at right now, to show that it does get better. And then just implementing, like, even if it's just small, like agility drills on the court, like somewhere a different environment, just so they can kind of, get picked back up mentally and physically. And then adding that stuff in earlier, along with, it's okay to load patients. It's okay to load people after they had surgery, like as long as you're within that time. And my thing at first was like, when I first started, I was always scared that I was going to like re-injure them or load them too fast or do this, or, "Oh no, they can't do a squat because what if their knee, what if something happened?" Like, the body's resilient. Like, if you have a good surgery, like once you get to the point where all your, beginning basic stuff, your range of motions back, your quads starting to work, you can start adding in like sports related stuff. It doesn't have to be full go. You don't have to be jumping and landing and like doing like you're playing in a basketball game. but just adding in that, obviously the mobility part and recovery. I do a lot more like hands-on stuff now, even if it's, I do dry needling, cupping, all that stuff, not as like a treatment itself to like fix anything, but just for something to like help them loosen up before we work out, or something that's just gonna like, even if it's mentally just in their head that like, okay, yeah, that feels good. Like I feel better, just to get them going. Whatever's going to motivate them to get up and get going is what I'm going to do. So I just have a lot of things, bags of my tricks that depend on the person and their personality that I can like pull out, try to get them going. But yeah, after surgery, ACL, it's kind of like the same thing. It gets boring and monotonous at the same time. I was seeing 6 patients sometimes a day of ACL, and I'm just sitting there like, oh my God, like, all right, quad sets, straight leg raise, your hip stuff. I'm moving them around. All right, next one, 45 minutes, same thing. And I was like, God, this has to get, we're missing something here. Like, you can't be doing this for 2 months. And then when you have your own business, it's kind of easier to like branch out of the physician like protocol and like what you're supposed to be doing in the clinic, and you can get more into the sports related stuff quicker, faster than you can. That, and like I said, loading them earlier.
And so as you were talking about, loading an athlete and, almost like that anxiety that an athlete might experience, because I think there's kind of like 2 different types of athletes coming out of injury that I've seen is you have, the gung-ho athlete who's just like, go, go, go. I want to be ready yesterday to play. And you have to slow that athlete down. But then the other side of it is the athletes who are a little bit more apprehensive through movement. And this kind of ties into something that, we'll kind of go into here, is the mental aspect of recovering from injury and performance. And I have one athlete who's coming back from a knee injury. He's getting ready for lacrosse tryouts coming up here. And we have an incredible treadmill that goes up to 25 miles an hour. It's called a Woodway. And so, we do intervals on that, A, to help his running mechanics, and B, to get his conditioning back so he can run repeated sprints. But when we get into the harder reps, after every single rep he gets off, he'll touch the back of his knee. And I'm like, dude, you got to stop doing that. And he's like, what? Stop doing what? And I was like, dude, every time you do a single speed rep, I don't care what it is, you touch the back of your knee. Do you realize that's sending a message from your brain to your body saying, my knee is still hurt? And so I was able to have a really good conversation with him about it. But can you dive into that mental aspect of recovering from an injury and how that ties into, performance and mental performance down the road with athletes who are coming back from these injuries?
Oh yeah, you'll see, cause like you just said, that just the touching of the back of the knee, you'll see them almost to the point where when you start working on, like, you get off the table and you start actually doing some more like, running or performance type stuff, you can almost like see in their face, like if they make a move and they're like, they want it to like give it, they think it's just gonna like break, their legs are gonna snap off. So it's like getting to the point where you can push them to where they can see that, yeah, your body's able to do this now. Like you can do that. And even if some kids are, like you said, the apprehensive ones that, they don't want to do anything because they think they're going to get hurt. There's even simple things of just like, all right, so you're using your left, you had surgery on your right. Now all you're doing is using your left leg to off balance, take pressure off that because you think you're going to hurt it. I'll just take the whole leg off and put it on a stool and have them do stuff, just putting all their weight on that leg. Even just taking, like, so they can't compensate, and just looking for the compensation patterns when they're training. But yeah, it's huge with the athletes and the mental side of it, because they're used to going full go, being good at what they're doing, and then they get cut down to where if they're not competing and they're not doing anything anymore. So it's just like that reassurance factor, and letting them know, like, you had surgery, you're good to go now. Like, we can start working on these things. Like, you need to progress. And that's what I was saying too, is the biggest psychological parts, bringing in somebody that's been through that surgery, that's ahead of them, that's advanced like a couple months, so they can see that this does get better. It's not just them in the clinic worrying about like their injury, like you said. And just seeing that there is progress, there's light at the end of the tunnel, and they will get back to that point. And obviously, it's dependent on the athlete too. Some of them they want to get right back and go, so you do have to hold them back. And then that's kind of like use a little like scare tactic, like, you know, it's like, you don't want to be doing this yet because, you know, you're gonna be out another year. Just take it, you know, a couple months at a time and see where we're at. But it's tough depending on what level athlete you work with. The age range is also like difficult. Adolescents, they don't like to talk, so it's just trying to get them to like explain or tell you like kind of what's going on in their life, and just building that rapport with them overall. It's what it goes back to is like having them, if they trust you, they're going to believe in what you're telling them, and they're going to kind of do a little bit more of what you're doing. And then just having them, showing them through like what their performances and their exercise and strength that, you know, you're at that level, you can start doing this stuff now.
A little bit early on about kind of your strength background. And I know if you go far enough back on your Instagram page, you can see some pictures of Dr. Jack at about 235. Is that right? I mean, big and bulky and flexing, and you think, oh boy, this is the same guy. And so I kind of want to transition to talking about how, and this has come up in the last couple conversations we've had with kind of basketball specific coaches, is the fact that a lot of times basketball players, I think just the sport in nature, or maybe the availability to basketball hoops in basketballs kind of, you know, in any park or in any gym. A lot of times we see basketball players won't prioritize strength training because 365 days a year, they want to prioritize their skill and ability on the basketball court. And that doesn't ever let them peak or optimize other parts of their life. I think you're in an awesome position because you not only do the strength training with them, but you also do the skill work. So you're able to kind of feel out the athlete and see physically where they're at and where they need to be. And then sometimes you travel with them. And again, we can talk about that a little bit moving forward. But what are some of the things that you think our basketball players need to understand about strength training that they don't get because they're always thinking about how they need to spend more time on the court to get better at the sport of basketball?
Yeah. The simplest thing I tell them is, you want to jump faster, run faster, you need to strengthen your muscle growth. And that's kind of what I go over them with, even at the beginning of the year, you know, because the skill stuff, all that playing, dunking, yeah, it looks good on social media. I was like, but if you're not in the weight room, like working on certain things, like even it's injury reduction, you want to play a whole year, 40 games, and we're traveling, like your body needs to be resilient. So this off season is huge. You need to be in the weight room, like worrying about that stuff. Skill stuff you can do on your own anytime. Like this is going to be more like toning you up to get ready for a season that they probably never experienced before because they've been in high school, and it's, you know, high school, you play Tuesdays and Fridays, maybe a Saturday. And it's kind of like, you know, you have practices after school. Well, the kids that come to our school, you know, they're basically there to play basketball. So it's, you know, you got 2-hour practices, you got skill work, you got workouts. So it drains their body. You know? So you guys need to focus on this strength stuff a lot more now, not only to get ready for college, because when you get to college, it's going to be a whole new, it's going to be a whole new beast when you get in that weight room. You don't want to have your eyes wide open, like, what the hell are these guys doing? They're crazy. They're monsters. So it's like just building up their mental for that and making them realize like the skill work will get better when you do the strength work, and the mobility and the recovery and the nutrition, sleep, like everything that goes into the sports performance stuff is going to just assist and make your skill stuff even better.
But it seems like you had mentioned, high school athletes, you know, play like once or twice a week. And then the best ones are going to go play some type of AAU or some type of travel ball, and they're going to play way more. Frequency is going to be way up from their actual sports season. So what can an athlete do to kind of prepare their bodies when they ramp up aggressively into playing more and traveling more and sleeping less and eating crummier, right? Like what can they do kind of earlier in the season to hopefully help themselves, you know, feel good moving forward through those crazy schedules of their travel seasons?
Yeah. So like earlier in the season, at least with our guys, so we'll have like we usually have a 10-week like off season, preseason before we start games. So that's kind of when we get in there, and I start addressing like the education for everything, with like the nutrition, like how to take care of their bodies and hydrate, and the sleep issues. And I actually have a whole like mobility program, because we use like an online platform, Team Builder. for like all of our stuff. Like I put the lists, and then we have documents for all their stretching, mobility, and injury reduction stuff. So basically just getting them in there, going over everything so they're familiar with it. And then throughout our workouts, I always add in like a type of like mobility cool down type of program so that they're actually familiar with it, for that when the season comes in, I can say, all right, go to this, we're going to be doing this document, everybody just go in the weight room, this is what we're going to go over. So it's not like you're not teaching during the season and having to like worry about any issues that might arise. They kind of know what to go to if they're having like, oh, my knee, patellar knee hurts, like they know what to go to exercise wise and like what to do recovery wise for that. And then having them just make sure they reach out like to me during the season. Because like you said, there's a lot of kids that I get in the off season, they play AAU. And like I was telling, I don't know if I was telling you or it was in the live, but these kids are playing, 5-6 games a weekend. And then that turns into like Friday, Saturday, Sunday. And next Friday, Saturday, Sunday, they got 6 games. So that's 12 games in like 1 week. And then some of these kids that I get in, they're not really lifting during the season. And, I talk to their parents and they're like, well, they got practice and they got games. So, I'm going to wait till off season. I was like, it's the seasons when you need to be like, we just did all this work to get to the season. And now you're not going to lift and lose all that. And then you're going to come back and want to start all over again. Like, they need to be doing at least like, at least 2 days during the week of like some type of strength training, mobility work and stuff like that. And then gets into the same thing, like who's their strength coach at the school and who's doing this. And, it's easy for me because I have control over all that with all our teams. Like I can do their recovery, their rehab, their strength and conditioning. I'm with them so much that I can even just watch them walk in and I already know like, oh, is your back hurting you now? Because just by the player's personality and how they act, and they have something when they're injured, they're like get hurt and try to sit out of practice one day. So yeah, I mean, throughout this, the prep thing's a grueling season. So just making sure they're up on like they're taking care of their recovery, taking care of their body, and then before the season starts, actually like putting 100% effort into like the strength training and the programming. Because once the season comes, we kind of cut down on some of the heavier lifts here and there because we have 3-4 games a week and we're like traveling too. So it's harder to get them like consistent workout days in. So we're trying to do even before games, we do some stuff. After games, we do stuff. So it's just trying to find that schedule to where, where it fits in correctly and just program it right. So obviously you're not going to be in there doing a meathead lift before a game, but still moving around, doing some stuff that's gonna make a difference to help with your injuries rates decrease and just keeping them mobile throughout the whole season.
We've talked a lot, a little bit about like some of the recovery aspect of how important that is for these athletes to be able to go, in that long-term season of year-round basketball. And even those guys that are playing AU, that doesn't mean they're not playing pickup games on the side. And we get into some pretty aggressive pickup games on Fridays with the T3 staff. And I'm just, wanted to pick your brain on like, how do we recover from some of those intense, 5-on-5 games? Like what are some of the recovery protocol that you have built in with your athletes that maybe me and CT can start incorporating so we get our bunnies back?
Obviously it's going to be athlete dependent and what their problems are, but usually, like when we have a long week of games, I take advantage of Normatex, some massage gun stuff. Rolling, we do a little bit, but basically I just have them like get up and move around, like so they're not just sitting stagnant like for so long. Because you get sore when we have long bus rides. There's sometimes we're in a bus for 6-7 hours. We try to stop, get out, do some stretch, move around, even walking on a treadmill 5-10 minutes just to get your blood pumping and moving around. We do utilize like ice baths when we have, a couple back-to-back games and the guys are just really sore. But for me, I just tell them, I'm like, the worst thing you can do is just not do anything. So you want to like get up, maybe do some yoga. I'll send them like different videos here and there. GBG, Mike G has some like good mobility videos that he does with his athletes. So I'll send them like a video of like 8 exercises they can just put on their phone and watch, and we'll go through like the movements and yoga stuff. But yeah, I mean, it kind of just depends on how many games we had, if it's actually just like an injury or if it's just like their body's just toasted just from like playing. So I try to just get them moving with the less amount of loads through their body and just kind of like get everything moving so they can just get some blood flow, and just use different things to switch it up. So it's not always like, oh, I got to go stretch, I got to foam roll, because I have to like beg these guys to stretch. And I'll come in and they're like, Dr. Chet, can you stretch me? And I'm like, dude, what'd you do at home? I was like, what do you want me to stretch? They're like, my low back hurts. I was like, all right, what's 2 of the exercises in the document for your low back? And they're like, I don't know, you usually stretch me. I'm like, dude, you need to be doing these 3 times a day. Like,
yeah. And I think especially like with your setting too, because right, these are college prep kids. These kids come to see you because their goal is to play college strength, like college basketball. And they're going to be in that open environment where like there's more guys on the roster. There's not as like secluded of a unit that's working together for the same goals. And they're going to have to take some ownership in terms of their own recovery, because you don't know the level of strength and conditioning program that those kids are going to, because just because it's a Power 5 school or a D1 school, that doesn't mean that there's going to be appropriate things for them to be doing strength and conditioning wise and recovery wise. Exactly. You know, how long does that take for them to like flip the switch and be like, oh, I get it now. This is really going to make me feel better, even though I'm going to be uncomfortable for these 10 to 15 minutes of this mobility work.
Yeah. Usually the high school prep kids, probably a couple months till they start getting into it. Cause then they're doing the workouts and the strengthening. Cause a lot of the kids, you know, they haven't really trained, like worked out, like as a program. They'll go to the gym and do stuff. But yeah, usually a couple months, like 8 weeks, it'll take. Like the guys that are going to do it, they're going to do it. If not, then they're just, you know, they'll do it here and there. But the guys that are going to like buy into everything and like do it are usually they're really good players, and then they'll buy in pretty quick, because they'll start seeing the results not only in the weight room but on the court. And then it just like clicks in them. They're doing dunks they weren't able to do, and they're feeling better the next day. Like, oh, I'm not as sore as I thought I'd be. And then you'll see the guy next to him that wasn't doing this stuff for the last 8 weeks, and he's like, oh, you know, I'm sore as hell. I don't know what's going on. I'm like, you've been doing the programs? Well, a little bit. Like, I'm busy. I'm like, you guys are here to just play basketball. How are you busy? Like, there's no way. You got 10, 15 minutes. But it's like, that's why I make them do it like with me sometimes, even when we're on the road. We'll do it like in the hotel. We'll go down the hallway, like do some stuff, just because I know they're not going to, like, it is what it is. High school kids are just, they're not, either they're going to do it or they're not. And a lot of them, you know, they don't want to do that extra like little bit to get better. And that's why you got really good athletes, and you got ones that are just going to make it by and do what they want to do.
Yeah. And I think for me, like, I didn't realize, like, I guess how immobile or how like not functional you could say my body was until after I had graduated with my exercise science degree, and I had been working for a year. And then I just randomly went into a CrossFit gym, and overhead squats were part of the workout. And I was terrible at them. And I'm like, what the hell is going on? I'm an ex-college athlete. I played 2 sports, and I went to school for this. Why am I being exposed right now? And it really kind of set a line of like, you know, a deep dive into like, what can I do since this sucks? What can I do to not suck at it anymore? Yeah. Are there any kind of like, I guess, like moments in the weight room that you see kids with, like movements that you ask them to do that they suck at, that they're like, oh, I need to get better at this because like my body should be able to move this way?
Yeah. I mean, the one, it's like, it's difficult with anybody. Like even me, I still suck at it. Just like doing a hang clean. It's one that they all like. So one of our coaches, he got so pissed that he wouldn't even do them anymore, because he was trying to work out with one of our guys, and it was like, great golfer, like he's smooth, like his body moves good. He just couldn't do it. Like even after the whole year of training, he like just couldn't get it down, and he just got so pissed off he just quit doing it. And even just the simple like hip hinge, just that movement with every exercise. Just seems like kids just want to fall on their knees. They don't know how to like move their hips back and use their butt and like stretch everything out. So like single leg RDLs, even, you know, squats, even just basic squats. So a lot of these kids that haven't worked out, it looks terrible. It looks really bad. Their knees are touching, they're falling forward, and like that's when you gotta just, break it down and then show them. And once they get it, they'll do a weight that they like, oh, I'll just put 25s on because I couldn't this last time. And once they get that movement now, especially for like squatting, like their maxes and just their weight that they're able to do just goes up substantially, and they just get that look on their face like did they do it right? And then they always want like confirmation too, which is nice. So they're like, hey, did I do it right this time? Like, watch me, did I do it? Because they'll see one guy get it down and then the next guy and all that. So the main moves are just like the hip hinge stuff that I see difficulty with, and then like the hang clean is probably the hardest one for them to actually like get down doing.
Yeah, and there's a lot going on in that movement. You have to control a bar, put force into an object, and you also have to move your body around that bar, which there's some crossover in just that learning a new motor pattern into basketball. CT, how's your mic working? We good?
Yeah, I was just gonna say, let me know if I break up here. Are we okay?
We're good. Yeah, you sound great.
Okay. Yeah, again, I apologize for that, paying too much money for Wi-Fi that doesn't work consistently. Dr. Jack, on a point to the hip hinge, a point to the hang clean, I do want to ask about, and you mentioned earlier, you got 6'8", 6'9", 7 foot guys where coaches are begging them to squat to depth, right? And depth being, ass to grass, whatever kind of that standard is for that gym. What should we expect our athletes to be able to achieve depth-wise in a squat or depth-wise in a lunge? What are some of these things that we can look at some of these human beings that feel differently than I will ever feel doing a squat? I will never know what it's like coming down from 7 feet tall. James will definitely never know what it's like coming down from a squat 7 feet tall. What can we maybe demand of them to be able to reach a certain standard for them to still be able to feel good and feel confident with their movement patterns?
So a lot of stuff for like the taller athletes, like just looking at the squat, like I basically just, you have tests, see where they're at to begin with. You obviously want to try to get more mobility if they're not like it. I just go by like the 90-degree angle for that with them. That's kind of where I want them to be at, but I'll use more of like a single leg, like pistol squat with them guys. So I'll have them actually like just on a platform that's higher. That way they can drive their body down more. So I use a lot of that single leg squat. The lunge with the taller guys, that's a little bit easier than the squat, just because I just have them step and then drop their back leg down. So they're usually able to do that just because they're normally, once they get it down, obviously, but they're used to like getting on and off the floor, like when they fall down and getting up. So I just kind of drill that into them, like just step forward and just drop your back leg, because they step and they want to just go forward, like lunging and their knees all over the place and they're falling over. But yeah, for the squat, I love using like Matt Johnson at Butler strength coach. He'll always post stuff with these guys on like 30-inch boxes, and they're just on their single leg, just like doing single leg pistol squats on it. And I think that's great for them to try to get mobility and build up like eccentric strength and control and balance all in one, and even with their core. And that'll kind of teach them, if they get one side down, the other side down, and then just start working on like that squat depth a little bit more. But I have a couple 6'7", 6'8" guys that are, they can do a pistol squat on like a 30-inch box, and they're going all the way down to like where it's bent. So I'll use some of that knees over toes guy. We'll go over some of that stuff too with them, just for their patellar tendon, like health and strength and just mobility overall. But yeah, I don't really focus on like how deep they're going. Obviously, if you go to a certain depth, you're going to use more hamstrings and a kick in. And so we'll do a lot of hamstring work for them guys that can't actually, like, they're tall and they're just not going to get that deep. And I got them for, usually our team, I'll have them for a year. So it's like just continue to build. As long as I'm seeing progress with their mobility and stuff, and that's kind of where we go. And as long as it's not drastically like to where they're just taking it off and going like down and up. Like I want to see some movement out of it. And so that's why I'll use like the single leg stuff a lot more than just worry about like the traditional back squat, or even have them doing front squats with it, goblet squat.
Yeah, we've had a lot of success with those bigger guys. First, elevating the heels, keeping the torso a little taller, and letting them use their legs a little bit, and then also, regressing from a front squat to a goblet squat. I think it gives those athletes a good opportunity to get kind of in those better positions. James, did you have another note you wanted to make on that? I want to talk a little jump training.
I was just going to bring up the heel elevation as well.
Yeah, okay.
I was just going to ask, based on that, is that something that you utilize? And in CT, I think it's funny that you called like a goblet squat a regression from a front squat, because like I have to constantly like talk guys out of that. It's not, to me, it's not a regression. And I don't mean to contradict you here, but like this is like, for me, it's like, hey, we're all right. There's a 150. Nobody's lifted it yet. Who's going to be it, right? So, I think the outputs can be similar. But, yeah, Dr. Jack, kind of heel elevated squats, it goes around the YouTubes and the Instagrams. And I found a lot of success with it, helping my overhead stability and overhead squats. Is that something that you incorporate with some of those taller guys?
For sure. Like we'll do elevated heel squats, especially for the guys like they have decreased like dorsiflexion. Like some guys just have like stiff ankles, and so they'll have like a ankle mobility program. They'll work on squats that way, the heel elevated. And then we actually have a machine at my gym to where it's like a platform, but then it has like a little raise, so they can actually go on that and hold up here, and then they do squats like that way. So it's like a little more focused, and they're not really having to worry about like their heels, and it kind of hits their quads a lot more. It's almost like a vert type of machine.
It seems like it's like a modified hack squat. It looks pretty sweet. And then there's like badass chains that like move the gears. Looks pretty intimidating.
Yeah, so it's a good one for that. And like even just doing, like you could do like double leg squats, and I'll take some of the weight off and have them do just like single leg jumps, almost like a French contrast type of thing on it. And I'm huge with I love doing the heel elevated stuff, especially for taller guys, just so they can even get that depth and just see it and feel it and get some of them muscles activating and working that they wouldn't normally get able to activate and work.
And you mentioned the dorsiflexion issue, and I think what we see a lot of times with basketball players specifically is they tape their ankles for everything, right? So then when they get in the weight room, the ankles are taped and they have high tops on, and then it can't. And then they wonder why their ankles won't move at all. And so I just had a conversation with our guys last week about that. And so that's why elevating the heels has been a little beneficial. We just want some flexion and extension. We want to open them up a little bit because they're so tight in there all the time.
Yeah. And even just for Achilles health, like you don't, if you're always in plantar flexion or some form of plantar flexion, then you go to stretch that out. But Achilles is just so tight in the calf that it's not going to allow it to go, or just risk of it. Just like you take a quick jump, and you have some sort of tear in a calf or Achilles, and that's something you definitely don't want to deal with, is an Achilles tear.
Oof. Yes, absolutely. I have a couple things I want to touch on here, and then we'll kind of get into our almost rapid fire questions. But the next few questions don't have a ton of continuity. I just want to make sure we get some stuff answered before our time runs out. So jump training. Do you have certain things that you like, certain things that you do that you've seen benefit from athletes, seen benefit from, obviously working in the basketball space? That's what a lot of us want to do as players. What are some of the things that you've been able to do to have some success there?
Yeah, I like using, for the jump training specifically, I like using like a lot of French contrast training. So I'll do some like, power explosion movement, do a band resistant movement, then just like a body weight. So like kind of like a circuit. And then other than that, it's basically just jump, like just do jumping stuff. Like don't overdo it. Because, kids, once they're able to dunk, that's all they want to do. So that's all they're doing on the court. So basically just getting them in there, teaching them the mechanics, a lot of calf work, like just to get that flick of your ankle, getting your calves and the anterior tib like stronger. But yeah, it's just a lot of like power, single leg work, working plyometrics, depending on the athlete and like what their position is, what they need to work on vertical wise. I'll just load them up and then take the load off, and then have them doing like the single leg Bulgarian split squat jumps, and just different forms of jumping, working in different planes of movement, from like lateral frontal plane to like transverse, have them like doing twist jumps. And obviously for basketball, it's just they want to jump as high as they can so they can do the best dunk they can. So it's, you build that strength up first, and then incorporate like your body weight, just band resistant type of stuff. We do have a Vertimax at the school, which we'll use a little bit, and I kind of give the guys a program that they can do like twice a week, just that extra stuff that we're not doing in the gym. So it's basically a program where they're not going to hurt themselves, but it's not going to be complicated to where they can't understand it. So they'll do like Vertimax jumps, Bulgarian split squat holds, and then they'll do like Bulgarian split squat jumps, like a superset. And then just working in some like trap bar, barbell jumps and stuff, basically just loading their jump mechanics with it.
Awesome. And I love how you said earlier, just jump too. That's another thing I find myself cueing. I find myself cueing that more at the gym, because they want answers, right? Athletes want answers to well, is it one? Is it two? And I'll say, just jump, just go jump as high as you can and figure that out. How about what I think is super, super cool and specific to your unique situation is that you have athletes that you're working with from overseas who come in just to play basketball and work with you. Are there language barrier issues that you have to work through? What's that look like?
Yeah, I mean, there's usually they're with their English. Like our guard Mike, he's actually a top 100 player. He's going to Dayton. His name's he's from Mongolia. So when he came in, like he was just more of a shy kid. Like he still understood like what we were saying, and he can speak English really good. But yeah, the barriers kind of, usually we'll have another player on one of our teams from that country that usually can like almost like serve as an interpreter for everything. And then just a lot of them will just, okay, coach, like that's what the thing. I'll be like, how you feeling? You just rolled your ankle. Okay, coach. And they just say the same thing. And I'm like, then you got to start, the more you're around them and like know their personality, it almost makes it like what they're thinking and what's going on. But yeah, we usually have, at least the 2.5 years I've been there, and like the players I've worked with, they're either from the United States and then went overseas to play, or they have another player from the country that speaks, like can translate for them. So that helps out a lot, especially at our school, because we don't have an interpreter or anything like that. So just hopefully, like when we get a kid in, like there's somebody that understands their language. But they still just kind of look at me and smile and, all right. I'm like, you don't have any idea what I just said, do you? And then I'll ask their buddy, does he know what I'm saying? He's like, no, he doesn't know. So I was like, tell him this and tell him this, or I'll write it down and like give it to him, and then I'll go over it later. But yeah, it's been pretty smooth so far, knock on wood.
Yeah. We'll keep our fingers crossed for you. How about traveling and training, and traveling and eating too, which I always think is I know is so important, right? And a lot of us kind of let that stuff go when we travel. You're taking teams to Indiana, you're taking them to the East, you're taking them West, you're taking them all over the place. How are you able to kind of help them, optimize sleep and eating around a crazy travel schedule?
I think sleep's probably the hardest thing, because except for the days we travel, then they're knocked out when they get to the room. But, they room together, so they're up on their phones, they got their girlfriends and they're messaging on social media and all that stuff. That's the biggest part. The good thing about our team is that we actually have, so when we travel, we'll have team breakfast, we'll have team lunch, and then team dinner. And then in between those, so we're actually going somewhere, we're bringing food and all eating together so we can keep track of all that stuff. The in-between meals, like, it's basically, here's eat a Rice Krispie treat and get a Fig Newton in you before a game or during halftime if you guys are tired. Just like force feed them some of that stuff. But yeah, sleep's the biggest part. Like the meals are pretty easy just because we have it pre-planned already. So it's there and they have to eat it. And our coach is really good about that. He'll just be slamming them like, make sure you guys are eat double, like drink your water. And we get waters. We bring things of water to everybody's room so they have enough water, and make sure they drink it. And on the way to the game. So it's pretty easiest on the road because everything's provided for them. The hard part's when they're actually at the school, because they have options of DoorDash stuff, and then they have like the school meals that some of them aren't a fan of. So they're like, oh, breakfast had like these watery eggs. I'm not eating breakfast today. I'm like, just eat something. Eat oatmeal and like peanut butter and sandwich. You can't just not eat something. So actually, when they're home, it's probably hardest because some of the food they just don't like it. It's at the school.
You said
trying to figure stuff out.
Watery eggs. I think we all have had like gone to a hotel and
they do that, and then they'll have like porks and like, and so they house it like Andrew Osborne, and there's a lot of kids from different nationalities and cultures and all over, so they try to accommodate to everybody. So sometimes they'll just have food and the kids are like, I'm not touching that, I'm not eating that. So then they go DoorDash, McDonald's or Five Guys, and which some of them I'm like, hey, just eat something because you need to put on some weight, because they usually come in underweight because they've never really done anything or ate and just played basketball and burned all their calories all day. So getting them to eat's the hardest part of it. So the road's easy. Home is where the hard part is.
Right. Couple kind of easier questions here. We want to learn a little bit more about you, Dr. Jack, and then we'll wrap up and let you go. But we're just wrapping up the NBA All-Star weekend here in Cleveland, which was awesome. If anybody saw the All-Star game or any of the events, there was a lot of action down here downtown in Cleveland. That's why if you're watching the YouTube video, I'm wearing one of my Indiana Pacers Reggie Miller jerseys, one of my favorite players of all time. Dr. Jack, who is your favorite NBA player of all time? Did he make the top 70? Did he make the top 75?
Yes, he did. Allen Iverson.
Oh,
Allen Iverson was my favorite growing up because I was a guard and I was little, so I always like would try to dunk. And I remember watching him at Georgetown, and that was kind of like one of the first guards I remember watching. It was like he would just take off and dunk on people. And I was like, that's what I want to do. I liked Michael Jordan, but I wasn't like, because I'm a big Cavs fan. So when Jordan was around, he wasn't really the favorite person around Cleveland because he just beat us so many times. But yeah, Allen Iverson was probably my favorite of all time.
Yeah, I picked my Reggie Miller jersey out of my like 11 Allen Iverson jerseys that I have in my closet, because I figured this was appropriate. But yeah, I just had the conversation yesterday with one of my basketball groups that I train. They said, "Hey, who's the GOAT? Who's the greatest of all time?" And I said, I know what you want to hear, but my answer is Jordan is number 2, LeBron's number 3. And they were like, wait, no, behind who? I said, obviously AI, like the greatest player of all time. Again, his height, what he had to do on the court, what they asked him to do. He had to play every minute. I mean, he took statistically the worst NBA team of all time to play in a finals, that 2000 finals against the Lakers. I mean, he was just doing stuff that I don't think anybody will ever do again, especially at his height.
Yeah, and just mentally tough, like a dog on the court. Like you weren't rattling him. That's why I try to get some of our kids, because you work with some of these kids and they just don't have that dog mentality. I'm like, you got to watch Allen Iverson if you're a guard. Like, check out him. It's like nobody was doing shit to him. Like he was coming at you.
Yeah, and I still think to this day that's why I have tattoos, because I grew up watching him and drawing them on me. And so anyway, James, we'll have you leave, and then Dr. Jack and I are going to do an hour podcast on Allen Iverson. All right, how about favorite basketball movie?
What was that?
Do you have a favorite basketball movie?
Blue Chips.
Okay.
Ooh, it's been years since I've seen that.
Yeah, that was good.
Yeah. Just because Shaq was one of my favorite too.
Yeah.
Yeah, growing up.
Yeah, and again, a funny thing about anytime Shaq comes up, I always think about there's somebody on the other team who has to guard him.
Yeah. Oh God.
And there's a coach all week who says, "This is how you do it. This is how you stop Shaquille O'Neal." And the guy's like, "Dude, what?" This guy's over 7 foot.
And I think that was my favorite, just because like growing up, like watching him dominate, and then seeing a movie with him in it, and kind of like, seeing what he did in like high school, and like I was like, this is insane. Like you'll never see that again. Somebody like that dominant as the center, like just tearing it up.
No way.
Anytime someone brings up Shaq, I have this like image of Kevin Hart impersonating how he falls. And it is, you know, and like to me, it's just like
with his legs up.
Yeah, with his legs up. That's just so funny because that is such a big man.
Oh.
We'll have to link the YouTube video to the show notes for anybody interested in that. Okay. What is next? What's next for Dr. Jack Lemmon?
Next would be, I mean, obviously finishing this season out and you know, seeing what this off season has, because every off season I've been doing training at Upgraded Industries for, I think it's going on 4th year. Yeah, because he's been open since 2017. So it'll be just, you know, seeing how this off season takes off, creating that. I'm looking at doing, obviously I'm going to try to delve more into like doing podcasts and like lives and just putting some more educational content out there. Like you said, I've been kind of like slacking on that just because I was, you know, started a new thing with the school and I'm like their only guy in the school. The prep team just started out. So I've been kind of focusing on that a lot with all the players. So just doing a little bit more, you know, social media presence, podcasts and things to like just educate people that are on there and like actually follow me and try to build up that presence a little bit on that side. And then just keep see what happens with this prep school and just keep working with that.
Excellent. We're excited to be able to be number one and have you, you know, number one on the list for the first podcast you've done. So thanks for giving us that opportunity. Last question here. We wrap up every podcast with this. What do you think, Coach, that we are missing? We as in, you know, strength coaches, as far as the basketball performance field goes?
That's what basketball performance, I would say probably just training them like basketball players, like focusing on like the skills that they need for that specific person, what he needs to work on, being able to assess him at the beginning and then create a plan that's actually going to get him better at the skill set that he needs to take his game to for the next level. He wants to play at the next level. Basically not treating every basketball player like a basketball player. And this is what you're going to do because you play basketball. So obviously centers got to be trained different than guards, and guards and wings got to be trained different based on their attributes and what they need to work on. So just being able to like pick out stuff that's going to actually excel their attributes and get them to the next level where they need to be. Not just doing a cookie cutter program that you pulled off Instagram just because, well, this basketball player was doing it and having no idea what he's even working on. It could just be a couple blips from like a whole workout that they're doing. Just knowing that, you know, you gotta be a little detail oriented in what your goal is and what the player's goal is, and try to just work together to get to that, reach that level.
And that is not back and buys Monday, chest and tries Tuesday. Legs
you gotta throw in a meathead pump every now and then just to make it feel good. They all like that. Like I throw in the leg extensions just so they can see the veins in their quads and they feel good about putting their short shorts on now that everybody wears.
Right. They all come back. James, what do you say about the quad?
This is our quadcast. Oh,
quadcast?
Oh, sorry. Yeah, the quads are the new biceps. I should say that too.
Right. Especially for the basketball guys who often don't have the big biceps, but have the big quads. Doc, thanks so much for coming on. We appreciate you having
me, man. I appreciate it.
We appreciate you being here on episode 34. We got a Mentor's not too far away. We can make that trip.
Yeah, man, we can set something up, man. I'll even come out there. I actually did, I worked with Ben G out there.
Oh, he's awesome.
Yeah, I was with him when I was doing my rotation. So I actually worked in conjunction with him. I had a couple of my athletes have went to him for insurance reasons for rehab, and then I kind of did the sports performance end of it. So yeah, he's a great dude. He's awesome. So I know where you guys are located. Yeah, we definitely need to get together one time. I'll let you guys ball on me.
Yeah, I was gonna say make it a Friday so we can hoop together.
Exactly.
Yeah, that would be
exactly. Fun. Then we'll need. I'll need you guys to do recovery shit on me because I probably won't move.
We'll just go.
That'll be perfect. We will. Yeah, right. We will collaborate. Hey, thank you again, everybody listening. This has been episode 34. Dr. Jack Lemmon. Hope you took a ton of awesome information from this podcast. We ask you, as always, when we wrap up, to do 3 things for us. 1, continue to practice gratitude. 2, tell the people that you love them every opportunity that you get. And 3, live your life stimulated. Thank you all so much. We'll see you on the next one.